All right, Becky, how can I help you today?
Well, I'd like to know about the methadone clinics.
Okay.
Are they good? Are they bad?
Well, everybody has a right to an opinion, and having practiced addiction medicine for 20 years and knowing quite a bit about methadone clinics, in this doctor's opinion, I would say they're bad. Methadone was a drug developed by the Nazis in World War II, ergo the trade name Dolphine, and it was basically developed to keep troops at dangerous positions. Methadone is an opiate agonist, and it basically occupies receptor sites in the brain, and the whole idea of methadone is to stop opiate addicts from craving. But naturally, methadone is addicting. So the opiate receptor sites are occupied by methadone rather than Codeine, Oxycodone, Heroin. But it's still an addicting drug, and that's why people go to the methadone clinic on a regular basis. So you're still an active disease, but you're taking methadone as opposed to heroin or Oxycodone or whatever else you were taking.
What about is it Suboxone?
Suboxone, buprenorphine, that's another drug that is used for opiate maintenance. It's opiate agonist, and it's an agonist antagonist. In other words, it's not quite as strong as methadone, but it's also very addicting, and it's available in wafers and used to be able to be taken nasally. But Suboxone clinics are also similar to methadone clinics, where you're still taking an addictive substance and the person's not clean and sober. So the whole idea is that they're taking Suboxone or methadone, they're not going to be drug seeking. All right. Methadone was originally developed usually to take care of chronic heroin addicts. And the problem now is that the majority of people going into methadone clinics may not only be addicted to methadone, to opiates per se, but they can be taking a plethora of other drugs as well. Cocaine, marijuana, and so they go to this methadone clinic, and now they get on methadone, and they're supposed to urine test for these clients to see if they're on other drugs too, and frequently that may not happen. So the methadone individual usually ends up having their dose escalated up to 110, 120, 130, 140 milligrams of methadone, and so many of these people are on these high doses, they never get off of methadone, and they stay there at the methadone clinic. And then what kind of people are they going to meet at methadone clinic? They're going to meet other people who are in active addictive disease. Mm-hmm. And that may not always be good either.
So now, do they take the cravings away from wanting the street drugs?
As long as they're actively getting loaded with methadone and having all these opiate receptor sites, the cravings for opiates may not be as pronounced. True. But the point of it is, frequently they do other street drugs like stimulants, because you see, methadone and Suboxone are opiate-like drugs. True opiates all come from the poppy plant: thebaine, morphine, codeine. All right. Then you have the synthetic opiates: hydrocodone, Vicodin, oxycodone, Oxycodone. And then you have synthetic opiate-like drugs such as methadone, Suboxone, fentanyl. In fact, chemically speaking, methadone is somewhat similar to Dorvon or Profoxaphene. And these are chemical agents that act like opiates in the brain. So when you're taking methadone or morphine or Vicodin, they occupy the same receptor sites in the brain, mu, kappa, delta, sigma, and the brain gets this relief and it gets this euphoria. And with junkies who like, opiates, heroin, that type of drugs, when they take methadone, all these receptor sites are filled up, so hopefully they won't be craving. But they're still taking an addicting drug. If they don't get their methadone on a daily basis, they go into withdrawal. And the withdrawal from methadone is long, it's protracted, because methadone has a half-life of about 24 hours. And that's why when people go to the methadone clinics, and they're good boys and girls, and they've been there for 22 years, they get their take-homes, or they only have to go maybe a couple times a week, and they get the take-homes afterwards, or they can take their methadone at home. But all in all, people get on the methadone clinics, they stay in the methadone clinics, and they're not clean and sober. They're still taking a horribly addicting drug. What's the difference if it's Oxycontin, heroin, or methadone? It's still addicting.
Okay, at the clinic, they tell them, we've got you on the highest dose. So if you quit it, cold turkey, then it could cause your heart to explode. Is
No,
that
it's
true?
not going to make your heart explode. God only knows what these addicts tell each other. Truth and fact is, if take a gal who's pregnant, who's on methadone. Well, females who are on opiates who become pregnant, it's not wise to withdraw the pregnant female from opiates, because they're usually the only humans that die from opiate withdrawal would be the fetus. When a fetus goes through withdrawal in utero, that can be life-threatening. Generally speaking, withdrawal from opiates, be it methadone, Suboxone, fentanyl, morphine, Vicodin, Tylenol, with codeine, whatever you're taking, is like a really bad case of the flu. Nasal stuffiness, diarrhea, abdominal cramping, insomnia, real or imagined pain. I've listened to these whiners for years, and they may have some vasomotor symptoms with elevated blood pressure, a little bit agitation, things like this. No, their hearts are not going to explode, but they'll tell you anything to keep taking the methadone. And when they're on the highest dose, what they're on is the highest legal dose, okay?
Mm-hmm.
I don't even know what it is now, probably 140 milligrams, something like that. But the bottom line is, when they get up that high, I've never known of anybody to be titrated down or weaned off a methadone dose. They stay junkies, and they're around junkies all the time. Are they doing crack? Are they doing marijuana? Are they doing meth? I don't know. I'm not really sure how often they really urinary drug screen them. The bottom line is, if they find them positive for other opiate drugs, like hydrocodone, oxycodone, things like this, then they may chew them out or they may kick them out. But generally speaking, you got a paying customer there. Why are they going to do that? A lot of these methadone clinics, in fact, the majority of them are privately owned. That's business. It's just that simple.
Okay, so if someone gets on the addiction buster, would it be better if they stop going to the clinic cold turkey? Or should they do both?
In the ideal scenario, if they have symptoms such as high blood pressure or other untoward symptoms, or they have a pre-existing health condition, it would probably be good to have your dose titrated down accordingly, at a regular interval, or to have professional care at the same point in time. But to get on something such as Addiction Buster, which is non-addicting, natural, doesn't require a prescription, and can treat pain, that can also help treat the anxiety and the withdrawal and the uncomfortable feeling where they're uncomfortable in their own skin, it would be much better to treat those symptoms with something like a non-addicting natural formula like Addiction Buster. It's put together specifically with kava, N-acetylcysteine, magnesium citrate, and this basically normalizes the pleasure center, treats the agitation and pain, and stops those unconstant vasomotor symptoms. Yes, it'd be better doing that. That way you're not strung out. You're still strung out when you're taking methadone every day. I don't care, or Suboxone every day. I met a guy in a train trip. My wife and I went to Chicago. This guy was a nice guy. Got to talking. He had a total knee done several years ago. He was strung out on hydrocodone, and now then he's on Suboxone, and he's taking his medication 3 times a day. And he had to be sure to go to his clinic to get his doses for his weekend trip to Chicago. What's that all about? He's still strung out, but he's just on Suboxone instead of, hydrocodone or the oxycodone. Just like with methadone, you're still strung out. So yes, a non-addicting natural formula like Addiction Buster 2 with craving aid would be a much better way to approach this problem.
Okay. So then, how long would it take him possibly to get completely away from the other drugs?
Well, that's a good question. How long does it take an opiate addict or any addict to get clean and sober and stay that way? Well, number one, you're never cured. Number two, the significant point here is that it's going to take somebody who has this type of addiction a year, 2 or 3 to normalize the electrical and chemical balance of the brain. Opiate addicts in particular have associated with their withdrawal moodiness, mood swings, down mood, irritability, insomnia. And they always have a reason why they should be taking pain pills, okay? You need a recovery program on top of something such as Addiction Buster to help normalize the electrical and chemical balance of the brain. You see, with the opiate dependency, you're going to have to normalize, pleasure center, along with the cravings, along with the withdrawal and the moodiness. And it probably would take at least a couple of years, and you'd have to be alerted to what's going on in yourself with regards to the way you feel internally. You don't get clean and sober, walk around in a treatment center for one weekend, eat bananas and doing phenobarbital, because you leave these places usually with addictive medication in your bloodstream.
Mm-hmm.
How are you going to get clean then? You come out, you go through withdrawal, you have the same problem back again.
So there's a medication that can help with the cravings?
Yeah. We've been using craving aids. Cravings for alcohol, drugs, and behavior tend to come from irritable membranes, destabilization of membranes, and we have a specifically formulated formula with specific ratios to help augment GABA internally, where these craving aids, it crosses the blood-brain barrier and increases GABA, which kind of calms down things that helps with the long and short-term cravings. Because you see, withdrawal is a combination of cravings, detoxing, relapsing, withdrawal, and then long-term, the cravings can come on a short or long-term basis and lead to relapse. So these are things that have to be treated on a PRN as needed basis. But you can't treat the stuff with methadone or Suboxone, you're still a junkie.
Right. So if there's no high blood pressure, nothing like that, then would it be better just to quit going to the clinic?
Yeah, as a matter of fact, to be honest with you, unless there's some wild problem, because a ton of people get locked up on methadone, and guess what? There's no color TV, there's no nurse taking your blood pressure, you're locked up in a cell, and guess what? The vast majority of these people do just fine. The only problem, if they get locked up for a month or two or 3 or 4, they get out, they still have the cravings, guess what they do? They go to the methadone clinic the minute they get out. I know I had a couple of patients who did that against the judge's orders, and guess what? They went to the methadone clinic, they got back into the methadone, and one guy got a 10-year sentence, so there's no methadone clinics in jail. They don't put up with that. And it's a good thing.
Mm-hmm.
What do you think? You'd have everybody at the methadone clinic there in jail. And they come out bigger junkies than when they went in. It's crazy. It makes no sense. I don't know how they exist. The vast majority of those people that are going to those clinics usually are not the people sticking up joints, robbing people. You get that more in the stimulant abuse and dependency, the meth, the crack, the cocaine, this kind of stuff, But they're popular, they make a ton of money, and they get a lot of repeat business.
Okay, so then how can we get Addiction Buster and the craving?
Oh, go to addictionbuster.org. We're there to help. We're on Amazon, amazon.com. And I have a terrific group of professional people. We're all involved with this. We have a site. The site is addictionbuster.org. And go there, money back guarantee. All you got to lose is your addiction. Read the information we've got. We've got blogs. We've got articles. We've got the whole neurophysiological approach of how it works and things like this. So, the methadone people I've known that go on to these clinics, they have a certain flat affect. Their mood is not human, it seems like. Everything centers around the methadone. You get demineralization of bones. You get premature aging. It's not really a way to live unless you want to star in The Walking Dead, It's just, there's a lot better ways to live.
Yes, there is.
And the families are upset. The clinic comes first. I got to go to the clinic. To heck with the clinic. Get clean and sober. It's like being pregnant. You're either pregnant or you're not pregnant.
That's true. That is true. Well, thank you very much for your information.
I hope it helps you.
It will help a lot.